Welcome back. In this section, we're going to review healthcare news that occurred this month. The practitioners at Family Practice Associates are going to review stories that we might find interesting to you. The first story is flesh-eating bacteria in the Florida waters. Dr. Applegate tells us things that we need to know.
Well, the issue with the flesh-eating bacteria is that it's actually been around for a number of years. In medical terms, this is called necrotizing fasciitis. It is caused very commonly by group A strep bacteria, and that may sound familiar to you as the bacteria that causes tonsillitis. We will see cases of this flesh-eating bacteria, or these cases, occur in the elderly, those that have compromised immune systems, such as diabetics and individuals with kidney disease. The important thing to know is that whenever we have a cut or a scrape or a scratch on the skin that becomes very red suddenly and quickly over a period of 12 to 24 hours, and if you notice that the pain is out of proportion to any other type of cut or scrape, that needs medical attention very quickly. We have more cases, or several cases, that are occurring in the warmer waters of the ocean, but quite frankly, it can occur in any of the streams or lakes or rivers, and we just have to be aware of this. So keep an eye out for any skin, cut, scrape, scratch that is red or extremely tender.
Great information. Also this month, a major new study suggests that it's possible to avoid dementia. Dr. Hayslips tells us ways to reduce our risk.
In a recent study, they found that adhering to a healthy lifestyle reduced your risk of developing dementia. In a study that was presented at the Alzheimer's Association, they found that by doing some simple things could help really reduce your risk of developing Alzheimer's disease. What they did is they looked at 200,000 patients who were 60 and older, and they followed them for 8 years. And they found that having a diet that was healthy, meaning one that's low in sugar, fat, and salt, regular physical activity, such as 150 minutes a week, not smoking, and low to moderate alcohol consumption really did reduce those patients' risk of developing Alzheimer's disease. And that was even in patients who had a high genetic predisposition for Alzheimer's disease.
Also great information. And the USA Today asked, can you get horns from smartphone use? Well, Dr. Hinkle tells us how to avoid problems that our devices can cause.
Hi, so with overuse of your cell phone, typically your head is down, your neck is flexed. And according to a study in Australia recently, that it can be equivalent to 60 pounds of pressure against your head every day. So over time, the tendons on the muscles in the back of our neck and head will cause calcifications to form at the base of our skull. And those are the horns that are seen with X-ray when any type of radiographic test is done on that area in someone who could be overusing their cell phone with their head down. So the best suggestion I have is either put your cell phone away for a while, possibly keep your head up, right, when you're using your cell phone. However, there's one other problem that we need to talk about, and that's called tech thumb. We talked about tech neck, now we talk about tech thumb. And tech thumb, unfortunately, becomes a problem from overuse of the extensor tendon and flexors of our thumbs. So overuse of your cell phone could cause tendinitis in that hand. The solution would be to either put your cell phone away for a while versus you could try using the other thumb for a while. If things are really bad, you could use a splint at night to help to rest your thumb in a neutral position versus you could try some ice. Or another thing is put your cell phone away for a while.
Great information. Put your cell phone away for a while. The last story, are supplements good for you? Dr. Johnson gives us the real story.
Americans spend billions of dollars each year on vitamins and supplements. The majority of vitamins and supplements do you no good whatsoever. In fact, these things go straight through you and into the sewer. There are on occasions when you may need some supplemental vitamins. The best way to determine that is to go to your doctor's office and have a blood test. The doctor will receive the results back and be able to tell you what, if any, you need and what doses you need. There are some evidence that omega-3 fatty acids and the Mediterranean diet are going to be beneficial in the long run, but this evidence is incredibly weak. Lastly, if you want to live well and live longer, the best thing to do is to avoid salt. There's good evidence for that. Exercise, and by exercise I mean aerobic exercise, which is defined as a minimum of 30 minutes an episode with your heart rate above 100 beats per minute, and a minimum of 150 minutes per week in divided sessions. And always maintain a normal body weight.
And that's a review of interesting healthcare news by Family Practice Associates. We'll be right back.